Hey, Dr. Shakib here from Irvine Spine and Wellness Center. We're going to talk about shoulder blade or scapula back here. A lot of times, so we're talking about the pain there and what can cause it. A lot of times what's happening is the shoulders are rolled forward, the shoulder blades or the scapula are sticking out more, which is basically a sign of weak shoulder blade stabilizers, infraspinatus, supraspinatus, and serratus anterior, which goes underneath the shoulder blade to stabilize the movement of the shoulder blade going out. You have to understand the function of your shoulder blade primarily comes within this range up, where it does most of its movement up to from being neutral to about this level. It's a shoulder muscle function. So if you have pain in your shoulder blade or in between the shoulder blades, you're gonna have to do a lot of different stretchings. I've done a video on what to do, and basically you need to roll your shoulder blades and your shoulders down and roll it around and bring your head and try to stretch your shoulder blades that way instead of going back and try to resume a military posture to crack your mid-back, so to speak. So pain in the shoulder blade or in between the shoulder blade, tension in between the shoulder blade is a sign of you having to strengthen so many different muscles there. I've done specific videos in my YouTube channel under the playlist shoulder, so make sure you watch those. And just wanted to let you know that if you have pain between the shoulder blades, it's not necessarily just the shoulder blade. It could be your mid-back, rhomboids, which is about right here in the higher area. And most of the times in my practice, I see the weakness of the infraspinatus, which is the lower part of your scapula. I've done a video on that, so make sure you watch that. And also a lot of times the teres muscle, which is right here, and also your lats, which bring the scapula or shoulder blades down and more in a diagonal fashion. Those are pretty weak as a result of our lifestyle of typing so much, and the shoulder blades or the shoulder joints go forward, bring the shoulder blades out. And so those muscles are really tired. You have to understand every muscle has an ability to shrink or contract, which is when it works, it actually does contraction. It stays neutral, and then it can elongate to a certain point. When the shoulder blades are rolled forward, your muscles in the back around the shoulder blade area, depending on which muscle we're talking about, if it's the infraspinatus as an example, or the lats, or even the rhomboids, they're stretched. When they're stretched, they don't have the maximum amount of ability to pull back and contract. So it's much harder for them to work when they're in a stretched state. So you need to be aware of what's going on and how to address it. So the reason I'm doing this specific video is because I find myself repeating this over to my patients. And so those are basically the clues for me to do these videos and give me an idea as to what videos to do. So that's essentially what's happening with the pain in the scapular area between the shoulder blade area and why it's happening. So like I said, make sure you go to my YouTube channel and under the playlist shoulder and watch those videos. They should help. If you have any questions, don't hesitate to shoot me an email or contact me at the office, and I'll see what I can do for you. You take care.